Hello everyone, every two and every three. Today, we're going to talk about Hermansky-Pudlak syndrome, or HPS. We're gonna make sure that we're gonna make it less complex and more fun.
And today's topic sounds like the name of a European law firm, Hermansky-Pudlak syndrome.
Honestly, when I first heard it, akala ko nga Harry Potter spell.
Same! But Hermansky-Pudlak syndrome, or HPS, is actually a rare genetic disorder involving albinism, bleeding problems, and organ complications.
So today, we're gonna talk about the etiology, pathophysiology, symptoms, laboratory diagnosis, and treatment of HPS.
Okay, Prima, let's start with the cause. Ano ba talaga ang Hermansky-Pudlak syndrome?
Hermansky-Pudlak syndrome is a platelet granule defect or storage pool disease, meaning may problem sa storage granules ng platelets.
So parang may platelets ka nga, pero kulang sa supplies?
Exactly, and it follows an autosomal recessive inheritance pattern.
So both parents need to pass the defective gene.
Yes, the disease is caused by mutations in genes like HPS1, HPS3, 4, 5, 6, 7, and AP3B1.
And the most common mutation is the HPS1.
It's also super rare, around 1 to 9 per million people, although it's more common in Puerto Rico.
So imagine being rare and complicated.
We're multi-talented! Now, let's move to the pathophysiology, which honestly sounds intimidating at first, but it isn't that bad.
So basically, the problem is defective lysosome-related organelles.
Which sounds complicated, so let's simplify.
So think of these organelles as storage and delivery systems inside the cells.
So parang Lazada warehouse ng katawan.
Yes, but in HPS, the delivery system is defective because of the mutations affecting the protein complexes like your adaptor protein 3 and your biogenesis of lysosome-related organelles.
And because of that, multiple organelles don't function properly.
Like melanosomes, which are responsible for melanin production.
So kapag defective ang melanosomes, which could lead less melanin production, it could lead to albinism.
So platelet-dense granules are also affected.
And those granules normally store ADP, serotonin, ATP, and calcium plus magnesium, or mas kilala natin as CASAM. They are needed for proper platelet aggregation.
So without them, the platelets become weak at forming stable clots.
Which explains the bleeding tendency.
And long lamellar bodies are affected too, which can eventually lead to pulmonary fibrosis.
So basically, one mutation decided to attack multiple systems at once.
Now let's talk about the classic triad of symptoms.
First is the oculocutaneous albinism.
So patients may have hypopigmented skin, light hair, and eye abnormalities.
Like nystagmus, strabismus, and reduced visual acuity.
Second is bleeding tendency.
Patients bruise easily. They also bleed longer after injuries and may experience nosebleeds or heavy menstruation.
Because again, defective ang dense platelet granules.
And third is the spheroid-like pigment accumulation or deposits.
Which is basically, it is the accumulation of waste-like pigment in organs like liver, spleen, and bone marrow due to defective lysosomal function.
Additional manifestations can include pulmonary fibrosis, granulomatous colitis, immune dysfunction, cardiomyopathy, and nephropathy.
So yes, Hermansky-Pudlak syndrome is definitely not just albinism with extra steps.
Okay, Fifi. If we suspect HPS, what do the laboratory tests show?
Interestingly, platelet count is usually normal.
Prothrombin time and activated partial thromboplastin time are also normal.
But bleeding time is prolonged because platelet function is defective.
In platelet aggregation studies, primary aggregation is normal.
but secondary aggregation is abnormal because dense granule secretion is impaired.
An electron microscopy is very important because it shows absent or reduced dense granules.
Never forget the cookie analogy.
Chocolate chip cookie means normal chocolate.
Then butter cookie means the platelet with absent dense granules.
So if your platelet looks healthy and sugar-free, it's a bad sign.
So unfortunately, there is currently no cure for Hermansky-Pudlak syndrome.
So treatment focuses on managing symptoms and preventing complications.
For severe bleeding, platelet transfusions or RBC transfusions may be given.
Desmopressin and antifibrinolytic agents can also help control bleeding.
And patients should avoid aspirin and your non-steroidal anti-inflammatory drugs because they worsen the bleeding.
Pulmonary complications also need careful monitoring.
So to summarize, Hermansky-Pudlak syndrome is a rare autosomal recessive disorder involving the defective lysosome-related organelles,
which leads to albinism, bleeding tendencies, and systemic complications.
And
That's it for today's episode. Thank